So let's talk about the next one of the additional points of friction, and that's the 2% provider tax. And I guess I'll look to you to start with you, Representative Baker, because it comes out of your area, the Health and Human Services.
It does. And, again, we agreed with Minnesotans 8 years ago that this was going to sunset at the end of this year. Again, it's between $650 and $700 million per year that we have been charging providers and folks that when you get sick, that's when you pay it. When you are healthy, you don't have to pay it. And it's not fairly taken care of the way it is now. We have to find a better way to, again, lower the cost of health care and not keep charging this higher fees. People were counting on this to end. I've got doctors back in Willmar. Don't you dare let this thing extend, because they're paying this thing, they're absorbing this cost. They write out checks every month to the state of Minnesota. Maybe it's quarterly. But they are sick and tired of doing this, especially when their reimbursements to help the folks that need it the most are so low. They just really feel like they're taken advantage of, and it's hurting us getting good providers to stay in especially the family doctor business and the small provider thing. I know a lot of groups want to have it go because it's just, again, it feeds this animal called health care. It's a problem, and we are trying to take better steps to bring down the cost of it. I think one of the things we need to do is look at our Minnesota Health Records Act that is the HIPAA plus on steroids. Minnesota overdoes it, I think, on data privacy. 48 other states do this well, and they don't have the same rules we do. And I've been told that's $250 million a year if it just conformed to the national HIPAA standard so that we're protecting that. Those are the kind of things we can look at in Minnesota to start saving real money on duplicative x-rays and stuff that's happening so we don't have to keep paying those bills. But I hope to see it end. I know it's a huge decision. There's a lot on the senator's back right now to sort of find the right way. I think our folks and my friends in the House want to spend it and they want to keep it going, and it's scary to me. I don't want to do that, but this is going to be one of our major issues at the end of the session.
Senator Clausen.
Well, I'm on the opposite side of the table. I think the feedback that I get that most people want to see it continue. Now, I understand that there is an additional cost to those providers because it costs money for them to run the system, so to speak. It's more than 2% to them. There's probably a carrying charge of another 3%, so I understand that. But that revenue really helps our healthcare system in providing funding for those that are less fortunate, and it's something I think we need to continue. Regarding I'm on the data commission, so last summer and fall, we dealt with health care records and protecting those records. So Dave brought up some interesting points. We spent a lot of time talking about protecting health care records for individuals, and we came to the conclusion that we didn't want to conform to the federal because our requirements are a little bit more stringent, and it may cost more money. We made some recommendations for changing some of the forms, maybe make it a little bit easier. But on the 2%, I'm on the other side of the table, and I'd like to see it continue.
So, Senator Rood?
Well, I'm really on the other side of the table now. I think for Greater Minnesota, keeping that tax is really harmful, and we will lose a lot of providers. And we struggle. Right now, in my area, I have great providers. But if we keep this tax on, we will lose them. And then my constituents will have to drive to St. Cloud, or they'll have to drive further south, and we won't have the health care, the phenomenal health care that we have right now. And I also think that if we are ever going to get reforms in health care, that the provider tax needs to go away, because it's like the gas tax. It's on autopilot, it gets spent. And if you would see where that provider tax is spent, it's been rated, and by both parties, both Republicans and Democrats, when they've been in office, have done that. And they have used that tax for things other than it was intended for. And so I think if we're ever going to get to where we can reform and get good health care costs, that tax needs to go away, and especially for Greater Minnesota, providing good health care.
I want to come back to you, Senator, in just a moment, but I want to give Representative Eklund a chance to weigh in on the 2% provider tax.
Well, again, I'm on the opposite side of the table. I think it was designed that way. And I think, Senator Rood, I'm probably just a little bit opposite. I'm concerned that if the provider tax goes away, that we're going to lose a lot of our small rural hospitals that maybe just have 1 or 2 GPs and a couple nurse practitioners there, and that's how they're surviving. And I have not heard from one of my hospital administrators in my district that the provider tax needs to go away. I have not.
But your hospitals can afford it. Your providers cannot.
Well,
That's the difference.
I'm just saying that I think it needs to stay, but I think they're probably. I don't like this idea of either party raiding the funds either.
Yeah.
And maybe if it stays, which I don't know whether it will or not, maybe we need to take a look at tightening things up to make it so it can just be used what it's for, and it can't be a rateable.
Well, and again, this opioid bill we talked about, this is going to raise $20 million new dollars. My idea was that the provider tax was going to go away. We came together, Julie Rosen and I, and we got to find our own money. So our idea was this was going to go away. We found this new money that we're going to try to get. So my whole plan was that because this was going to go away, we were still going to win on the lower provider tax was going to be gone. But hopefully we can use it for something else. But we're going to get it to work.
Senator Root, I want to go back to you. This is right out of left field, but I'm going to ask you this question anyway. Senator Abler and I think another member of the Senate had a bill, some thought about a special tax, think of tax basically on insurance documents or insurance records, claims basically on insurance claims, as a replacement for the 2% provider tax. Does that idea have any legs, or is there any discussion about that?
You know, I guess I don't know enough about that program, but I do know that there has been a lot of talk about how, you know, it makes a big hole in the budget and tails down the road. So how do we pay for it? So there's been a lot of really, I think, creative ideas on how we get that done. And I don't sit on that committee, so I haven't been privy to all of them. But I know that there's been some really good ideas about how do we fill that hole. I think it's about a $1.2 billion hole.
About $700 million.
It's a big.
We've only got about 15 seconds left. Have you heard anything about Senator Abler's proposal?
Yes, I've heard it's kind of also the Michigan model, and it's supported by the Minnesota Medical Association. It puts more of the tax on the health care plans, so it's spread over by a lot more people, and it leaves the doctors' areas to more of the health care plans. So, but it's still a tax, and it's something that they are looking at. It's simpler to operate, so maybe it's still something that they're talking about. I'm not sure.
All right.